Welcome to Pavan Medical Info. Today we'll be seeing the classification of diseases in detail, where the subheadings will be in four different varieties. One will be mode of acquisition, one will be the pathogenic classification, the third one will be the subclassification, last one will be the example where a disease name will be given. The word acquisition means the process of obtaining and development of knowledge through observation. If you observe anything and if you develop knowledge, that is known as acquisition. So the classification of diseases can be into two main headings. One will be congenital, the other one will be acquired. Congenital means it is by birth. Acquired means as you are living in this world, you will be acquiring it. Let us discuss the first one, the mode of acquisition, that is congenital. When you go to the second one, that is pathogenic classification, first one will be genetic and the second one will be non-genetic. So congenital will be discussed in two headings. One will be genetic, the other one will be non-genetic. When you come for the genetic, you have two subclassifications. First one is inherited, the second one is spontaneous. When you come for the first one, that is inherited, the disease which can be given as example is cystic fibrosis, and the second one in subclassification, that is spontaneous, the example what can be given will be the Down syndrome. This is about congenital, where I have discussed about the genetic classification. Now we are getting into the second classification in congenital itself, that will be non-genetic pathological classification. In that, the first subclassification will be environmental, the second one will be accidental. When you take environmental, it is from the environment, that is any infection, especially you can take example rubella infection, that is a viral infection. When you come for accidental, that is the cerebral palsy due to hypoxia at the birth. What is cerebral palsy means? It is the disorder which affects the movement of the muscle or tone of the muscle, that is known as cerebral palsy. So till now we have discussed about the acquisition, that is under congenital, where the first one will be genetic, the second one will be non-genetic. Now we are getting into the second mode of acquisition, that is acquired. Here some headings will be, the first one will be inflammation, the second one growth disorder, the third one injury and disordered repair, next one is hemodynamics, the last before one is disordered immunity, next it is metabolic and degenerative. So let us discuss one after the other with the subclassification and example of the disease. When you come to the first one in acquired, that will be inflammation, where inflammation will be subclassified into two, that is acute and chronic. For acute, you can give example as acute appendicitis. For chronic, you can give example as tuberculosis. When you come for the second one, that is growth disorder, one will be neoplastic and the other one will be non-neoplastic, where in one place it is carcinoma, in the second place it is not carcinoma. The neoplastic will be taking an example, that is lung cancer. For non-neoplastic, you can take an example of benign prostatic hyperplasia. When you go for the third one, that is injury and disordered repair, you can subclassify them into two, that is kinetic force and the second one is a chemical. Kinetic force means any physical force or any external force is there, you can give it into kinetic force. And the other one will be chemical, any chemical which has been induced into the body will go to the second one. For kinetic force, the best example will be the bone fracture. For the chemical, it will be aspirin induced gastric ulcers. Till now we have discussed about three things. Now we are getting into the fourth one, that is hemodynamics. Hemodynamics means how your blood is flowing through the blood vessels. When you see that, you can subclassify into shock and occlusive lesions. For shock, you can take example as hemorrhagic shock, and for occlusive lesions, you can take a best example, that is ischemic heart disease. Going to the last before one, that is disordered immunity. Now your immunity is in disorder or impairment. For that, the subclassifications will be immunodeficiency, first one. The second one will be autoimmune allergies. When you go for the immunodeficiency, the best example everyone can give is AIDS. The autoimmune allergy, the best example which can be given is Graves' thyroiditis, that is inflammation of thyroid gland. The last one will be categorized into a different category in acquired itself, where you will not have subclassifications, and the main classification will be metabolic and degenerative. There will be no subclassification in this, and the best examples can be given is number 1 diabetes mellitus, number 2 osteoarthritis. Osteoarthritis means wearing down of protective tissue which is around the bone, that is cartilage. If it is wearing down, that is known as osteoarthritis. So once again, very fastly, let us go to the mode of acquisition. First one will be congenital, second one will be acquired. In congenital, genetic and non-genetic, but in acquired, it is inflammation, growth disorders, injury and disordered repair, hemodynamics, disordered immunity, and the last separated one is metabolic and degenerative classification. Thank you so much.